Welcome to the third lecture of Module 5, the judicious use of confrontations, orders, and commands. We will begin to discuss the role of the use of confrontations, orders, and commands in healthcare using Gwen's textbook. The first learning objective is to define confrontation. The second learning objective is to differentiate between the levels and intensities of confrontations. The third learning objective is to understand orders and commands as explicit directives. Confrontation, without a solid relationship created through the communication of empathy, respect, warmth, and genuineness, rarely is helpful. This is a quote by Gazda, Childress, and Walters. Just by looking at this quote, what are your interpretations of it? Would you agree or disagree with this quote? In the previous lessons, we've been focusing on gentle techniques to prompt patients to engage in collaborative problem solving. However, there are times when it is appropriate to express judgment and urgency. Providers must draw on their expertise and experience, and sometimes this requires being more forceful in their approach. Confrontations, orders, and commands involve providers being judgmental and evaluative. This approach has been historically used given that power and authority rested mainly on the providers to exercise their own authority and strongly insist that patients follow important orders regarding their treatment and care. These responses are typically appropriate to ensure proper action on behalf of the patient. Confrontation is defined as a deliberate use of statements or questions to point out to another individual certain discrepancies. These discrepancies may be differences between what persons say and what they do, the differences across several elements of communication or statements made over time, and the differences between what individuals should do and what they are actually doing. Providers can provide their point of view or feedback about a patient's discrepant behavior, which can be informative and can actually contribute to patients' insight. Confrontations can vary on intensity. Low-level confrontations are less intense and consequently arouse low levels of emotional response. When confrontations are offered in a friendly yet ambiguous manner, the intensity is low and the threat is low as well. For example, a provider may say in a friendly fashion, "Okay, I know you forgot to take your medications due to personal circumstances, but if you miss it again, I'm going to get upset." Other confrontations are moderate, but they are not direct, but they do come with a warning. A provider may say, "If you continue to avoid taking your medication, you will not be able to get better soon." I have had lots of patients in your situation, and those who avoid their medication struggle with getting there. Confrontations can also be highly intense, which can arouse intense feelings and can be perceived as highly threatening. Unfortunately, they are highly unlikely to encourage change and most likely to upset patients. The provider may say, "I know you forget to take your medications, but if you keep avoiding taking your medications, then I will not prescribe them to you anymore, and I won't be able to treat you anymore." Confrontations that are highly intense come with a threat. Now, this is risky because here is where patient-provider relationships may result in breakdown. When providers use this technique, Gazda, Childress, and Walters found that patients might respond defensively, be driven away, become angry, and go on the attack, pretend to accept the advice but actually ignore it, and feel helpless and become inappropriately dependent on the provider. However, if the confrontation is too weak, patients might lose respect for their health provider, not even pay attention to the provider's statements, and might even receive the confrontation as reinforcing that the discrepant behavior is okay. Thus, when using confrontations, we need to make sure to avoid making them either too intense or too weak. There are two types of confrontation: experiential or factual. Providers can engage in confrontations that are experiential or that are part of a patient's personal experiences with a struggle they are currently facing, such as weight loss or the need to exercise more often. Confrontations can also be factual, when providers can present data that is factual in order to provide the patient with information and feedback. Both types of observations communicate patient discrepancy in the patient's behavior. Confrontations can make clients defensive. Thus, it's important to ease into confrontations and work on regulating intensity. Before using a confrontational approach, providers need to have already established a relationship built on trust and caring, using one of empathy and other relationship building skills to build this important relationship. One needs to lay out a foundation for addressing the patient's unique concerns and problems, avoiding appearing overly judgmental and critical. Identify any discrepancies that are obvious and define your own provider role and the level of commitment to the partnership. If confrontations need to be strengthened, given that patients are not taking proper action, providers can strengthen confrontations in the following 5 ways. First, make the reference more personal and more direct by making it clear that the issue is the patient's discrepant behavior. Second, provide concrete examples by recalling previous patient discrepancies. Third, include recent events to make it more recent in their mind. Fourth, deal with more behaviors and not just the words to apply more pressure on the need to change the patient's behaviors. Fifth, indicate behavioral contradictions from the patient's past. You can say, "The last time you were in this office, you said that you would stay on your diet. Yet, you tell me you didn't." It's important to adapt the intensity of the confrontation to the patient's behavioral needs. We need to be careful not to come on too intense unless we have gained the trust of our client. Confrontations are frequently associated with 2 additional therapeutic response modes: orders and commands. Orders and commands are the provider's action to elicit change by insistence. When a patient needs to adhere to a course of action, and this course of action is related to an emergent life or death type of situation, and providers need to issue an order if it is within the authority to do so. Orders and commands are useful for providers because it increases the probability that a certain action will occur immediately. It really comes down to giving orders or commands by directing patients about what the provider wants them to do under serious circumstances. Orders and commands in healthcare differ from confrontations and advice giving. Orders do differ with commands because commands denote the critical and immediate necessity for the patient to take action or engage in a change. In particular, pharmacists and nutritionists need to specify their orders in writing because there are important details that these orders need to be written. Here are some examples of simple instructions about a patient's medication. The doctor wants you to take these medications 2 times a day. This medication should be taken within an hour after eating. These examples exemplify not only advice, but orders. Once an order is issued, members of the healthcare team must evaluate the patient's level of adherence. If a patient is dealing with important healthcare issues, it is a provider's responsibility to continue to assess patients' adherence to the prescribed behaviors. For instance, a provider can continue to assess a patient's weight loss or progress on their treatments to ensure that the commands were adhered to. They may need to follow up as needed with future appointments. Sometimes commands fit into the category and need to be delivered immediately. These directives, like orders, are phrased as necessities, but the seriousness of the context is usually more apparent. Orders indicate that a behavior is mandatory and the immediacy of the action is clear. While some providers may be uncomfortable with commands, the skill of issuing both orders and commands is a necessary condition. Sometimes they do not take orders quite seriously. They might not even be afraid of the consequences, and thus providers need to reaffirm the seriousness of their directives by indicating the dangers of not following through the prescribed set of healthy behaviors, whether it's taking their medication on time, getting more exercise, or eating a healthier diet as examples. Providers must assess not only what has and has not been understood, but also how it has been understood. Usually, to assess the patient's response, the provider may summarize the important points of the discussion, including any reactive given, prompting the patient with a gentle command using the teach-back approach, such as, "Tell me what you heard and what you plan to do." To assemble all the essential facts of the discussion is useful. In any given interview or consultation encounter with the patient, patients need to be told that the session is ending. This can prompt patients to ask questions or clarify points that were not clear to them. Providers need to focus on the shared understanding, consensus, and plans that have come from the discussion with the patient. Now, how would you use confrontation skills as a healthcare manager? Sometimes issues may come up and you need to ensure to use your confrontation skills to seek change in behavior in clients, physicians, or even other staff members who are not doing what they're supposed to do. Let's go ahead and watch an illustration of a successful confrontation, but still notice how there's resistance along the way. Notice how both use nonverbal and verbal communication skills in this conversation.
Hi, Dawn. Thanks so much for making the time to meet with me today. I've had a real concern and I just wanted to bring it to you directly and let's just clear things up. So what I wanted to do today is talk with you about how your follow-up is impacting our team and its reputation. What I've noticed is you had volunteered at one of our last big team meetings to take on looking at the background for this project we're doing and seeing what protocol we were following. At the next meeting, you didn't have that done. A week later, when I went to you, you still didn't have it done, so we were scrambling to get that in place. A couple of days ago, I had a client call me. You were supposed to have a proposal in for their project last Friday, and they had never received it. Scrambled around, got that accomplished, and got it in. I'm feeling really worried about our team, about our reputation. I think we've got a lot at stake here. Number one, our team is looking really bad in terms of not getting work done on time, not following protocol. And second of all, we're going to lose clients. If they're phoning because they're not getting stuff, they're going to go somewhere else for it. I'd really like to resolve your follow-up, get some processes in place so that it's building our team And I really want to hear from you what's going on and figure out what we can do together.
Okay, so we're all busy. I'm busy. I'm sure that, like, what are the other people doing? That nobody else has missed a deadline, so I missed a deadline. Like, these things happen. Like, we're short-staffed here. We've got budget cutbacks. So I'm struggling here.
I can see that on your face, your struggle, your concern with the workload that we've got, and I agree with you. Sometimes we do miss deadlines. That isn't the issue right now. What the issue is right now is that you've been volunteering for jobs.
So you've taken on too much?
Maybe we're going to find out you are, but what I'm finding right now is it's become a pattern that you're taking things on and you're not meeting deadlines. I want that, the follow-up part, that's what we need to work on today.
So what do you want me to do?
What could you do to make sure that your follow-up is what the team needs and that you're meeting deadlines?
So nobody else is missing deadlines?
Do you know what? Right now we're addressing your deadlines and your impact on the team.
Okay.
Team.
My fault.
Yes.
I missed the deadline. It's not the first deadline we've ever missed. Lots of people miss deadlines. Like, well, which client? I think I could probably tell you who the client was. He's always complaining about every little thing and changing the plans every second week. We do a project and he's come up with 6 different ways that he wants to change it, and then we got to go back and use the plans. And so it's like, yeah, I miss a deadline, but he's going to change it no matter what.
You know what?
What?
You're right. Some of our clients are really challenging to work with. I agree with you. So what we can do is we can ensure that when we set a deadline, we meet it. And that's what I want to talk about, is our follow-up and how we're meeting deadlines, not about a client's behavior.
But nobody else has missed a deadline. I missed a deadline. Nobody else missed a deadline.
Right now, Don, we're going to talk about your part in the team. That can be addressed at another point. I'll write it down. I'll make a note of it. Make sure that I talk about those with anybody else that needs to be. Right now, we're here to talk about my concern with your follow-up.
My fault. Okay. So, yeah, that's just been really, really busy, and I feel bad about it, but just stuff's been falling through the cracks.
Okay, so Don, what can we do to make sure that things aren't falling through the cracks for you? Because you had volunteered to take on that part, to
maybe
look in
I'm
that
just
process.
taking on too much, or
what can we do about this to make sure that you are following through, and that you've mentioned the word priority, that it does become a priority?
I really don't know what I can do to change this. There's a lot of demands on my time, and I'm putting in the big hours here. Maybe more efficiently, or
Do you think that's possible?
it's going to have to be, because if this is coming to this point in the business, something's got to change.
Okay, can I just bring one thing in, that when I addressed it to you about not bringing the proposal forward, you told me you were going to work more efficiently then and set new priorities as well. And then after that, our client called that you hadn't turned in something to them. So I don't know if just setting new priorities and being more efficient is going to resolve this. What can we do so that your follow-up really is follow-up, and that you're getting things in on time? Because it is having an impact on our reputation, and like I said to you, clients are calling complaining, we're going to lose them. Okay, is there anything that you could commit to in terms of ensuring that a portion of your day is put towards a specific project?
That's actually really good. I can assign X number of slot my days in my Outlook. Will pop up, gives me a reminder, an idea.
Okay, so how are you going to ensure that you stay organized then?
I want to have clients out the door because I missed something. A weekly report.
Okay, and who would you give that weekly report to?
Whoever's running that project.
Okay, and we're a team right now, so who on our team would you choose to show that report to each week?
Me? I'd pick you. You had the guts to come in here and point out my flaws, and they are, flaws, weaknesses, whatever you want to call them. I screwed up, and you had the guts to come in and tell me.
Okay, so you're going to now, what are you going to do again to resolve this? Can you just go back through what your strategies were going to be?
Assign portions of each day to specific projects and give you a report at the end of the week.
Okay, can I just ask you one question though? What do you think you can do though if you're getting towards the end of the week where the report is due and you realize you're way behind? What could you do then so that we don't run into this again?
That's a good question. What would I do? Ask for help.
Okay, and who could you ask?
We're a team.
Okay, who could you ask on the team?
Steve knows just about as much as I do.
Okay, so
It'd be nice to have someone to bounce some ideas off of, and often, it's some
Okay.
little roadblock. And
okay, so how far before your weekly report would you go to Steve?
Wednesday.
Okay, so Wednesday of the week, if you see you're behind the eight ball, it's not coming through, you're going to go talk to Steve, see if there's some way he could support you.
Yeah.
What happens if Steve's too busy?
Gotta take another team member, I guess.
Okay, you could come to me. I'm part of your team as
Oh,
well.
that's right.
Right?
Yeah.
Right?
Well, I'm giving you the report. Well, yeah, that makes sense because I'm giving you the report. It's like Wednesday. I'm having trouble meeting this time frame.
Okay.
Sure.
Okay. So let's just go back over that because I need to be clear on what you're going to do too. Okay, so what are you doing?
Process is outline my week in Outlook with reminders that come up, a lot segmented portions of the day to specific projects. If I get into trouble, Wednesday I raise the red flag and come to you, and Friday the report gets in.
Okay. Okay. That's excellent. And if on Wednesday you go to Steve or you come to me if there's an issue,
Forgot
right?
about Steve already.
Okay. So thanks so much. I really appreciate this and I think I really hope it's going to go better.
Perfect. Thank you. Appreciate it.
You're welcome.
Did you notice the different levels of intensity used in the confrontation? Have you encountered an opportunity to confront a fellow client or worker? Sometimes some clients or fellow employees will not take responsibilities for their actions, just like patients, and they come up with excuses. Thus, it is our duty to confront them to ensure they improve on their set of behaviors. To conclude this lesson, you should be able to define confrontation. You should be able to differentiate between the levels and intensities of confrontations, and be able to understand orders and commands as explicit directives. Challenge yourself. The next time you have an opportunity to confront someone because they have not complied with an important behavior, challenge yourself to do so if it's appropriate to do so.